high definition. This is KCAL 9 News at 9.
Next on KCAL 9 News at 9, an LA County supervisor orders an investigation on a story we broke last week on KCAL 9 News.
It surrounds the CEO of publicly funded AltaMed Health Services and his $400,000 in raises that he's gotten in the past 2 years. The exclusive follow-up report next at 9.
Tonight, an LA County supervisor wants the state auditor to look at salaries paid by a nonprofit company healthcare provider based in Commerce.
This comes in the aftermath of a KCAL 9 CBS 2 exclusive report about the president of AltaMed Health Services, a taxpayer-supported nonprofit company making a total compensation of nearly $800,000 a year.
KCAL 9 political reporter Dave Bryan joins us live from downtown LA with his follow-up report. Dave.
Well, Sylvia, Lena, Supervisor Mike Antonovich says that the total compensation for the AltaMed president is very high. He also says the $400,000 increase is a particular concern, and he's asking the other supervisors to agree to call on the state auditor to check it out.
First question I would like to ask.
Following up on a report seen only on KCAL 9 and CBS 2 News, LA County Supervisor Mike Antonovich has introduced a motion requesting the state auditor to evaluate the salary structure at AltaMed Health Services, a taxpayer-supported nonprofit healthcare company. At the board meeting, Antonovich's motion was supported by a couple of public speakers.
A couple of times I have actually talked at this board about my concern about the way AltaMed was receiving money and spending money.
9 days ago, we reported that Costello de la Rocha, the president and CEO of AltaMed, received total compensation of nearly $800,000, according to a 2008 report filed by the company with the IRS. That was an increase of about $400,000 from the previous year's reported compensation. At a time when the bottom fell out of California's economy, the state budget deficit went through the roof, and many of the health and seniors programs offered by AltaMed were facing severe cutbacks or even elimination.
Some people look at that and say, wait a minute, you mean we're talking about eliminating this program for these poor people? And this guy's making, close to pushing $1 million a year to run the organization?
Based on the advice that we have received, it is within reason to receive the compensation level, which is also base plus bonus and other benefits that are part of that. It's within the reasonable standards and expected by the Internal Revenue Services.
AltaMed derives much of its revenue from state and federal health care programs funded by tax dollars. Jose Martinez told the Board of Supervisors through an interpreter he and his wife couldn't afford health care at AltaMed. Then he saw the report on the CEO's total compensation package.
When I saw on Channel 2 that the CEO of AltaMed makes $800,000 a year, I was upset. Because all I could think of was, what if some of that money was used to help people like me and my wife?
In an interview for our original report on AltaMed, I asked Mr. De La Rocha about the fairness of his total compensation.
Do you think you're being paid the right amount, you personally?
It's 33 years that I devoted here as a professional here. Do I think that devoting 33 years of my professional career to this organization and working for this, do I think it's fair? I absolutely think so, yes.
Well, Supervisor Antonovich's motion has been continued until next week when the board is expected to take it up. And this evening, a spokesperson for at least one supervisor, that would be Supervisor Gloria Molina, said she does intend to vote for the motion that would have the state auditor evaluate the salary structure at AltaMed. We're live in downtown LA. Dave Bryan, KCAL 9 News.